views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello, everyone. Welcome to the Social Justice Forums. I'm Daren, Jaime. And if you're asking what the Social Justice Forum is about, well, it's a show that actually brings you a deeper understanding into many of the inequities that people face. We talk about a variety of different topics, anywhere from economics to education, criminal justice, and yes, even student debt forgiveness. That's the topic of today's show. Stay with us. The Social Justice Forums begins right now. And welcome back. New York City Speaker Corey Johnson and the Women's Caucus of the New York City Council approved the preliminary analysis of anonymized and publicly available New York City employee payroll data conducted by the New York City Council. The analysis actually shows several things: significant gender, racial, and ethnic pay disparities in the city's workforce. Also, male employees, they actually roughly average about $4,500 more a year than female employees. The analysis also found that Black city workers average about $7,600 less than white workers, while Asians tend to make $6,500 a year more, I should say less than white employees. Now, here to bring us all up to speed and give us a little bit more about what this actually means and talk about this analysis is Councilmember of New York City District 16 and co-chair of the New York City Council Women's Caucus, Vanessa Gibson. And Councilwoman Gibson, good to have you.
Thank you so much for having me, Daren. It's always a pleasure.
Thank you. Let's get right at it. When we look at these statistics, obviously a lot of concern, particularly on the part of women, particularly on the part of minorities. When you took a look at the data and you saw what it actually brought out, give me your result. I mean, your thoughts.
So first and foremost, I was not surprised because I think for women and women of color across the country, you're constantly seeing efforts of pay parity, efforts of gender equity, making sure that we recognize that you should be paid equally for equal work, equal pay for equal work. And this information that we received at the City Council was as per local law 18 of 2019 that was passed by the City Council in late 2018. And essentially it was led by the amazing men and women of CWA, Communication Workers of America, Local 1180. And they came to us years ago and expressed a concern about a majority of their members, African-American women, city workers, not being paid equally. So we worked together with Majority Leader Lori Cumbo, the Women's Caucus, the council members, Speaker Corey Johnson, and we were able to pass legislation that mandated that the administration put forth data, payroll data on all 300,000 workers in New York City, data broken down by race, ethnicity, as well as gender. And what we ultimately saw, as you said in your opening, that there is a huge level of pay disparities between African-American, Latino, and Asian American city workers compared to their white male counterparts. And what does it say to us as a city? It says that if you are a white man in New York City, you will make more than your counterparts. And it doesn't speak to years of service. It doesn't speak to level of education. And once we get that data in early 2021, I'm sure we will see even more disparities with African-American, Latino, and Asian workers with more years of experience, more levels of education, and still not receiving equal pay.
Well, I mean, we can't say the handwriting was on the wall. Everybody actually knew exactly what the numbers would actually show. There are some people who actually come back and say, I'm a little bit surprised by this. I guess the main question people have is, where do you go from here? Given the fact that we've got the data, given the fact that we've got these numbers, where can we go to kind of make this pivot?
Right. So where do we go from here? We have an administration that has 1 year left, right? I think it sets the tone and it's a platform agenda to move forward. I think it's really going to highlight a lot of discrepancies we have in the city's workforce. So what I think we should obviously do is legislation is always a great way to codify measures into local law, but we also have to put this into practical life. As we recruit workers for the city's workforce, as we go through the civil service exam process, we have to make sure that there are policies in place that mandate equal pay for equal work, no matter what color you are, no matter what your gender is, and make sure that in every single agency, there's a level of oversight. And that oversight comes from the administration, from the mayor, the deputy mayors, the first deputy, and the entire team led obviously by the mayor. So I believe that this is going to be a fundamental change across our city for the new administration that comes in City Hall, the majority of new council members that will go to City Hall. It really does have to send a message, because not only are we fighting for current city workers, but we're also fighting for the future city workers who are young college graduates that will be coming back home with college debt, that have an expectation. I've worked really hard. I've got my bachelor's, my master's degree, and you're telling me because I'm a Black woman, I'm an Asian woman, I'm Latina, that I can't make the same as my white male counterpart. I think it's unacceptable. I think it's a level of disrespect. When you look at a lot of the civil service workers and the essential workers that have been working during the pandemic. So I think legislation is obviously the way to go. But we also want to make sure that we put a level of oversight from the mayor's office to make sure that every agency is following the rules.
Yeah. When we talk about seeing it get this far, obviously there could be a lot of reasons for why things actually got this far. But if I'm a person that's actually working, I know that sometimes civil service is sometimes a barrier. And I know you've heard that before, that sometimes the civil service jobs could actually be a barrier. Is there anything that can be done to help make civil service more palatable for people to be able to access jobs, particularly in those communities of color?
Absolutely. One thing we have to do with civil service exams is we have to do more advertisement, more promotion, and more recruitment. Many of the civil service exams are put on notice online in terms of just making it more accessible in that way. But a lot of folks don't really know about how to become a civil servant worker, how to join the city's workforce. So just like we had this fight a few years ago with school crossing guards, with not having them have to go to the local precinct to apply for a school crossing guard position, but we have to do better recruitment, whether it's 311, job fairs. We have to really, really mobilize an aggressive campaign across all neighborhoods, particularly marginalized communities of color that historically have not been able to get a foot in the door when it comes to becoming a civil service. What we also have to do is we have to have more sessions that provide tutorial and assistance for how to pass the exam, because that's another barrier in how we can't get in. A lot of these positions are civil servants positions, and you have to take an exam. And so if you're not prepared, I think it just further highlights the larger issue that we have around recruitment in communities of color with men and women of color, and really making sure that the city's workforce is always reflective of the city that it serves.
Yeah. When we talk about African Americans and people and those in communities of color, a lot of challenges to have to wade through, a lot of challenges having to, deal with. Talk about your district in particular. How do you get the message out to your district? How do you really say to them, this is what we found out, and then make them aware, and then also that call to action, if you will?
Right. So we do a number of different communication channels, whether it's social media, our newsletters that we mail directly to our constituents, a lot of TV, public access television, of course, BronxNet, because it's really important to meet and reach people where they are. Advocacy we do at local houses of worship, community centers, the local stores and merchants associations. A lot of that we've not been able to do in the capacity that we used to because of COVID, because you're just not able to get people in those large settings anymore. But that shouldn't stop us from the work we have to do. The call to action is that pay parity is a priority that we always strive for. It is not acceptable, no matter what gender, what race, what nationality you identify as, you have an expectation to be paid equally for your work. And we often have these days of recognition where we recognize, Black equal pay day, Black women equal pay day, Latina equal pay day, where we come and we recognize the disparities, but we also talk about solutions to the problem. Organizations like Her and many other women's groups that do this work every single day. They push legislative bodies to pass legislation to address pay parity, to say you cannot discriminate on someone, you cannot pay them differently because they bring something different to the table. Like if you are in a certain title, everyone in that title should be paid at the same amount. And that hasn't always happened. And so I feel that this local law that we have enacted, that the city has to comply with, has not only further highlighted some of the challenges we face, but it also is a call to action and attention. We have to do better on behalf of the city of New York, and we have to do better on behalf of all of the young adults, people of color, students of color that want to join the city workforce, that already see the barriers. We have to make it easier for them to become a part of our workforce.
How do you see COVID-19 playing into the city's, employment factor? A lot of people have definitely filed for unemployment. We know across the nation more now than ever before. Talk to us about how you see things playing out, particularly in the area of employment. We talk about the disparity in pay. You can talk about being hired. You can also talk about the fact of, listen, I'm out here trying to get a job in a time when having a job is almost like, unheard of in some areas, simply because COVID-19 has taken a lot of this away.
Yeah, it's been a real trying time for us in the Bronx. We've lost thousands of people to the pandemic. 1 in every 4 Bronx residents lost their job, lost their income and their revenue. Many have fallen behind in rent. The overall quality of life has really, really been a challenge. Access to quality and healthy food, basic necessities like a roof over your head have been a struggle for many families. And I don't lose sight of that ever. Every day I realize there are a lot of people out there that need help. That's why food pantry, soup kitchen lines are long. That's why I've worked with, Bronx EOC and VIP community services and others to host job fairs virtually. That's why I'm working with non-traditional employment for women on construction jobs for many of our females so they can come into an industry that's been male dominated. That's why we're still trying to do work remotely, because we're not able to meet in person. We have to offer an opportunity for many of our residents to return to work. And even now with a potential second wave, potential closure of schools and non-essential services, it's going to be even more tough. And so I don't want people to give up. I want them to continue to look for work, continue to, work with small business services, Workforce One, the Business Solution Center, so many different organizations that are still doing work, but it's being done remotely, and find opportunities. There are jobs out there, but we know that it's challenging for the Bronx. We're back in double digits on unemployment. And so it's really, really a tough time. Joining the city's workforce is also a challenge right now because there is a hiring freeze. And during the pandemic, we had to deploy a number of different first responders, nurses, and doctors and medical professionals from elsewhere, from outside of New York State, to come into New York City to help us. So it has been a challenge, but I really believe that once we rebound and get out of this pandemic, we can return to whatever normal means, right? The new normal, and really find a way to get people back to work.
As far as your district is concerned, you've got hospitals that are actually within your district that you're actually trying to deal with and making sure that they're adequately taken care of during this COVID-19. As these numbers are continuing to rise, what are you hearing from those who are working on the inside with boots on the ground as to what's going on inside now?
So it wasn't easy for our hospital workers. We represent Bronx Care. We've been doing a lot of work with health and hospitals with Gotham, Morrisania, and many other hospitals in the Bronx, North Central, Montefiore, St. Barnabas. And it was a challenging time. They were overburdened, overworked, understaffed, short-staffed, at capacity, not having enough PPE. And now that we've lowered the hospitalization rates by a tremendous amount, we're obviously very cautious of an increase on that. So every hospital has a certain amount of PPE that's already stored and placed in reserve, just to make sure we have enough hospital gowns, face masks, hand sanitizers, N95s, and certain things that they need. But at some point, if we do see the numbers rising as they have, and if that continues on that trajectory, we're going to have to ask for more support, no question. A lot of the money that we've expended is FEMA reimbursable, but we're going to have to ask our partners in Albany and the federal government to help us. And right in our own district, we have an uptick in a number of zip codes on the west side in our district, in Highbridge and Morris Heights. And it's very scary. So we are actively working on PPE distributions, COVID rapid testing sites at parks, at different locations, because we need people to get tested, but we need people to also practice social distancing, wash their hands frequently, and wear your face mask. I know it's not comfortable, but it's what we have to do to stay healthy, to stay safe, and to stay alive. And this district took a big hit. We lost a lot of people. So we want to be very mindful. The holiday season, Thanksgiving, Christmas upon us. We know that we are just not the normal, folks that we were before. We can't do everything like we used to. So everything is going to have to change based on the COVID-19 world we're living in, and still trying to find some normalcy in all of that.
Yeah. Well, I got you. I want to talk a little bit about the work that you do in the Public Safety Commission. A lot of New Yorkers, and particularly, well, not New Yorkers, I'll say New Yorkers and some community-based organizations have made their voices heard about really defunding the police, looking at how we're dealing with police issues right now. Given the fact of where we are right now, 2020, I should say, getting ready to enter into 2021, you've got boots on the ground on the inside track. Talk to me about that argument that's being made. How would you like to see things play out, particularly for the NYPD, because I know that your committee works very close with the work that goes on with law enforcement?
Yeah, so for 4 years, I chair public safety. I no longer chair the committee now, but I am still a member of the committee. A very, very tough time, a very tough summer. We had a rise in shootings and homicides, unfortunately. We had a movement for Black Lives Matter, recognizing that to be a Black man in America shouldn't be a death sentence. We saw police violence across the country, right here in our own city. We saw a lot happening, and we also faced a $9 billion budget deficit that we had to balance. So what ended up happening was there was a shift of $1 billion in expense funding to social services. It wasn't a blank check for $1 billion, but it had to go into the budget to balance it. So we were able to provide money for summer youth and Sonic, Compass, Beacon, Cornerstone programs. Unfortunately, a lot of agencies took heavy cuts, like sanitation and parks department. So there was garbage overflowing, parks weren't maintained, park staff. It was a lot. And I want to remind everyone, particularly constituents that reached out to me about feeling safe and wanting to see police in their neighborhood, we tried to find a balance. And so making sure that we don't have an impact on deployment, on response time, so that if there's an emergency, you can still get to someone in distress in a timely fashion. Persons in need of emotional disturbances and lots of things that we try to make sure are still addressed. But at the same time, looking at what public safety looks like, the future of public safety, redefining public safety, the crisis management system, the anti-gun violence organizations on the ground, Guns Down, Life Up, BRAG, Bronx Rising Against Gun Violence, SOS, RTG, Release the Grip. These are organizations that are on the ground that provide services around healthcare, mental health, therapeutic services. They have mobile units, they give jobs, they mentor kids. They do a lot on the ground, and they are a part of the conversation as well. And so we have to get out of this position of expecting police to respond to everything. They are not the problem solvers of poverty and underemployment and lack of health care and unstable housing, but yet they respond to everything. And that's not fair to cops, and it's not fair to us. But I feel like there's a role for everyone, and there is a role for NYPD and the work they do every day. But it's not just the reliance on NYPD for everything. And so that's what we're trying to do, and we're not there yet. Right? You can't enact change and reform in one budget. It has to be policy. It has to be legislation. It has to be changing the mindset of what we believe public safety is all about in our city.
We've only got a couple of minutes left, and literally a couple of minutes. Before we close out, I want to give you an opportunity to share a little bit about what you will be doing in your district as we get ready to end this year called 2020.
Sure. So our council district, District 16, Claremont, Concourse, Concourse Village, Highbridge, Mount Eden, Morris Heights, and Morrisania. We are actively working on PPE distributions throughout the district. We are promoting all of our active COVID-19 rapid testing sites at Gotham, Morrisania, Mullally Park, 1302 EL Grant. We're also doing a number of food distributions of fresh groceries and produce and canned goods. We've been giving out and will continue to give out turkeys to many of our tenant leaders at NYCHA, our homeowners, our residents that live in our co-ops. We're working closely with many of our civic leaders, the community boards. It is important for us to make sure that you see our office all the time, no matter whether it's an election or not, giving out food, giving out face masks, hand sanitizers, because it's important to make sure you understand that you are not alone. Our office is always here to help you. 718-588-7500. We're at 1377 Jerome Avenue at the corner of 170th Street. And our email address is district16bronx@council.nyc.gov. And most importantly, community, stay safe, stay healthy, take care of you and your family. We are all in this together. And during the season of Thanksgiving, we are grateful for every day we have. God bless you all. Stay safe, and happy season of Thanksgiving to each and every one of you across our district.
Councilwoman Vanessa Gibson, we're going to leave it there. Thank you so much for being with us. Continue to do the great work, and let us know what's going on in your area as we continue to let Bronxites know all the things that are happening in District 16 as well as across New York City. Thanks a lot.
Thank you. Thank you, Daren. Always a pleasure.
Always a pleasure. Councilwoman Vanessa Gibson, our guest here on the Social Justice Forums. Want you to stay with us. We're going to be talking about doulas as well as student loan debt relief, a possibility coming up in 2021. That's next on the Social Justice Forums.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting for BronxNet, who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
And welcome back. Being pregnant in this time can be extremely challenging. According to the CDC, African American, Indian, and Native American women are 2 to 3 times more likely to die from pregnancy-related causes than white women, and the disparity increases with age. Research has demonstrated such disparities like the egregious race-based difference in maternal mortality and the increased rates preterm birth reflect differences of quality of care, as well as decreased access to care, discriminatory treatment, and also other social determinants of health. Doulas are actually one way that they can help solve the social justice issue. Here now to provide more is the founder and lead advocate at the Federation of International Gender and Human Rights, Dr. Amina Ali. And we thank you, Dr. Ali, for joining us again.
Hello, thank you so much for having me once again. I always enjoy coming on. Thank you.
No, great to have you. It is certainly a conversation that needs to be had. I think when we talk about a lot of the healthcare disparities that go on, particularly that affect the African-American community, we can talk about diabetes, you can talk about HIV and AIDS, we can talk about cancer, but sometimes when it comes to maternal health, that doesn't always rise to the top, even though those numbers are extremely high.
It is. The unfortunate piece in that is that there isn't a continuity of care. So what I mean by that is there is a complement to care, which means that there is accessibility if you're in an urban area or if you're in an area that has resources that are available, you know, free clinics, clinics that are well maintained for women and maternal care. But for those that are language barried or disability barred, or those that just don't know that those programs exist, it could be sitting right next door to you and it not be accessed. And this is where we're trying to tie that gap. We're trying to make it a household name. And as we say, we're normalizing maternal health care in urban households.
Yeah. How would you define maternal health care as far as being a social justice issue? Obviously, we're on the social justice forums, but for somebody who asked the question about maternal health care, social justice, how do the two go together? How do you answer that?
Well, basically, if you are pregnant in the United States, we shouldn't even be having this conversation. This is a huge thing that we sit back and scratch our heads. Social justice just means just that. It is justice for us in the parameters of where we are economically, where we are geographically, and where we are demographically. And there is a big disparity between the three. The fact that we're here in the United States and we have to talk about this issue means that there is an intentional non-implication of these services. So that means they intended not even to offer these. So whatever it is that we have to provide it for ourselves. Well, 9 times out of 10, we as people of color especially, we tend to do things the way it is comfortable for us and as things are necessary. So necessity is the mother of invention. However, we have to make sure that we are up to par with that when we deal with maternal health care. We can't be dealing with 60s mindsets, and we're talking about going into the new, 21st century. So I think that what we're doing now is we're becoming more aware that there is a disparity, and now this is where the advent of help comes.
Yeah, and we talk about healthcare, obviously a major component in making sure that maternal health care is going in favor of those who receive services. Talk to us about what you see, what you like, and what you don't like.
What I see is there's a big gap, and I'm praying that it will be closed at least a little bit before I close my eyes. What I like is that we're having these conversations. The fact that you have me on here speaking about it in different parameters, leveling up on what it is that's being offered, and then allowing the women to know that it is here in the Bronx, which is the least accessed in the care as well as the programs. So the fact that the Bronx is getting it and getting it firsthand allows us to know that it's going to be divvied out in other communities. Now, what I don't like, oh my goodness, we could be here all day, and I know we only have a few minutes. So what I can say is that if I can get more people to get on board to become a doula, just to become a doula, that would set the record in how many people have access to the care. If you do it in Washington Heights, someone does it in Inwood, someone else does it in East Harlem, someone else does it in, Brooklyn. You will have more people addressed to those issues and more people speaking about it. So this is what I don't like. The numbers of becoming a doula are going down because they don't see the money in it, and it's not. There isn't any money in being a doula. It is all of the outcome, not the income. So it is about what it is that we're giving. So it has to be passionate people that want to do the work. So what we need to do is develop a different way to bring that passion home. And I think that's where we're doing with the COVID and post-COVID resources that we're aligning.
Dr. Ali, sometimes, we throw around the word doula and we assume that everybody knows exactly what a doula is. So for somebody who really doesn't know what a doula is, the work that goes into being a doula, would you please explain?
A doula is to a patient as the nurse is to the hospitalized person. So a midwife would be the doctor, the doula would be the nurse. So as it pertains to maternal care, those that come into your service, you're pregnant or your wife is pregnant, you would automatically call a midwife who would bring a doula, just like a doctor would bring a nurse. And most midwives worth their salt will not practice without one. This is saying that midwives, they don't come into the birth space by themselves empty-handed. They come with the visuals, they come with the tools, and they also come with the education, which is what the doula brings. The doula is the day-to-day, the midwife is on the event. So that means when it's labor, when it's time to birth, when she is in active labor, that's when the midwife steps in. Everything else is normally the doula. And she brings the education, the passion, the knowledge, the information. She brings the calmness, and she brings the know-how to get her safely to that point of birthing babies. So this is where we need more doulas, and we definitely need the advent of more doulas with different languages. Yeah. So, it is definitely necessary, especially in the Bronx.
So when we talk a little bit about the work of doulas, obviously a lot of work goes into helping that mother get across the finish line. And with COVID-19, childbirth doesn't stop. One thing that doesn't stop during COVID-19 is childbirth. Talk to us about how COVID-19 has actually impacted in the work that you're doing now, particularly post-COVID. Well, we're not even post-COVID, but
Well, COVID itself Yeah, brought along a lot of challenges. Oh my goodness. The fact that the increase in home births went up 110%. 110 historic highs. We haven't even seen this in any other categories in Katrina or any other catastrophe. Home births have gone up. Why? Because women don't want to go into a hospital where there's people with possible COVID to their left and to their right. So they're wanting to birth at home. So of course, midwives that were retired, we had to come out of retirement and we had to utilize our skills to be able to get mommies into a healthy environment so that she could birth her babies. We had mommies that may have not been well, maybe had diabetes or hypertension. We had to get her medication so that she could transition into a home birth. And then there are women that were going into a hospital and for the first time ever, they said, you know what, that may not be the best environment for my baby. So now we had to educate and then get her ready for this home birth in like 2 or 3 months. So it was an odd job, but it was something doable because it was necessary. And we were scoped with it. So I really must commend all the midwives that stepped up, all the doulas that took their place, and all of the birth workers that really set a monumental high to get these women ready for home birthing and then birth them successfully. So that's the bigger piece. Yeah. As far as after COVID, we have a couple of collaborations that we're doing with the city of New York. Now, a lot of it is still a little fresh. So there's a little pushback because they don't know what to expect of it. They don't want to deal too much in health because they always want to feel like the CDC and the WHO is like God himself. But we have to deal with this because we don't have any other officials that are doing this. We don't have any other people that are showing this. So what we're doing is a 3-part. We have accessibility, visibility, and accountability. Accessibility is establishing resilient, responsive, and inclusive healthcare systems that are accessible to all, irrespective of the socioeconomic or legal status. The health condition should not matter if she had pre-existing health disparities or if there's genetic or hereditary dispositions. Such systems should prioritize an essential health package based on the primary care principles. So that means it's personalized care. So instead of taking it from the institution of insurance, we're bringing it back into the hands of the women, allowing the women to make the choices and allowing the insurance to value their choices in their direction. The visibility is to have great advents to those that are reasonable accommodations. For example, we're doing primary health care, allowing them to have full spectrum care in a safe, qualified area. So that means safe as in the way the mother sees it, not the way science or maybe the hospital is wanting to present it. Because as we saw with COVID, it wasn't very safe. Right. And then we want to utilize the community. So if we have midwives that are in the community, they'll do a lot of their education, maybe some of their prenatal where they feel safe and they don't have to have that advent of the bacterium and the biological hazards of COVID in the hospital. And then we're dealing with well-trained, well-paid, cultural, language, and gender-sensitive health workers. This is huge. So many people have to just get what they get when they go to the hospital, and they're not given that choice. So when we're dealing with these new policies, we're bringing this home into the private sector, and we're allowing them to have the reliability of what they know to be true and right and bring it back home to them. And then the accountability is to know this is community-wide. So we're allowing them to be stakeholders and shareholders in their care and not just rely on what the doctor says or what the nurse says or even what the midwife says, because it is their care. So we're bringing it back home to them.
And when you talk about bringing care back home to them and then playing an active part in this, the accountability factor, I want you to just take a little bit more time and talk about that, because that accountability factor on their part is also huge.
It is. It is. We're dealing with vulnerable populations, first of all, in particular, fragile settings in maternal care, because you can't get much more fragile than maternal care. But in this, we're including disease prevention, immunization services, health promotions, and public health services. This means that each of them are going to take a part. So for example, let's say you have a son that is in Inwood, and you and your wife, let's say, had a child, and this child is getting ready to go into public health. That child is going to be educated in public health wherever, and then brought back to Inwood. So we're going to make that son now a part of the stakeholder shareholder forum. So you being a native of Inwood, you being the person that is susceptible to staying there because that's where you're from, you are now going to train your children to bring those same services back home. They're not going to go out and go to Tribeca and, you know, do the very plastic things. We're going to bring them back to their own neighborhoods and train them in their neighborhoods to serve those that they grew up with or those that they have been advantageous with to reconcile care with. So if you know that there is an oncology in, let's say, Washington Heights, your son is going to be trained in oncology and come back and service oncology in Washington Heights. So this is where we're going to make the accessibility more of an accountability. If you're going to live here, you're going to serve here. And this is to include maternal care and the women that are part of the maternal care system.
I want to talk a little bit more about the civil and social unrest that we're seeing here in our society too, and how that's impacted the work that you're doing, how it's also impacted, mothers. A lot of stress. And sometimes when you think about what's going on, we can tell people our blood pressure is going up, anxiety is going up. Talk about the impact that, all of this has actually had that you found, particularly with mothers.
Yeah, I've had one mother say that she really wanted to leave New York. And her reason was, she said, I'm raising a Black man in New York. She said, that's the most dangerous area in the world. I said, well, more of the people that are being killed recently are down south. So where are you going to go? So she said, well, I'll go into Canada. I said, well, those are the ones that are not reported. Don't think that it's not happening. So the stress level is really becoming a big thing where women are saying they're going to distance themselves from communities and countries. A couple of women are saying now they're going to be expats going back to the continent of Africa where they don't have to worry about that. Yeah, but they have civil unrest there too. You look at Nigeria,
right.
And look at Cameroon. Right. There is civil unrest wherever you go, and it's because of unjust governments. So why don't you stay and bloom where you're planted? Instead of leaving the area, I always recommend train a child up in the way in which it needs to go. So if there's a civil unrest for Black men, then who would be better able to stop the civil unrest than Black men? So make sure that you are in a tolerant area that allows men to be empowered, that allows the decisions to be made in their lives to be done by them, and then allow their environment to be safe. Stop tolerating injustices that are normalized, like the no snitching rule, or you don't tell what's happening in the community, or mind your business and you don't get involved in it. No, get involved and stay involved, and allow the men to have that voice to say, man, you're not going to touch this woman this way, or you're not going to handle this way, and allow the men to step up and do. I grew up with that. We call them basement parties. I grew up with men taking advantage of the fact that you're just not going to put your hands on a woman in my presence. You're not going to do that. And we lost that. And what's unfortunate about that is we've lost the power in our own communities. Thus, that allows other people to come into our communities and take the power from us even more. So I'm telling the women to arm themselves with knowledge, information, and the power they already have. There's more of us than there are of them. So remind their children that the more they are empowered together, the stronger our community can only be. So this is where I'm going with it. And every time I have a boy baby, I actually announce it. Here's another warrior being born. So it's an incredible passion and energy that's going out there, and I'm just glad to be a part of it.
Yeah, well, talk to me as we are getting ready to get into 2021. It's hard to believe we're already in November.
Already.
People say, my God, 2021 is right around the corner, but it is. Your plans for 2021 and the work that's going on.
Well, we are empowering ones that are indigenous of this land and indigenous of the African continent. And what we're doing in twofold. We are getting those that are being culturally trained here and to go back to Africa. And then those that are here, they're going to go to Africa and then come back with the culture. So what we're doing is it's almost like a hosting or a shared environment. And we're utilizing college and high school students. So we're doing a hosting program. And that is where you have women going over there teaching about the birth involvement. And then we're having women coming from Africa to teach what's happening in Africa. And we're seeing that we're alike. 90% of the women that talk about what happened in Kenya and Rwanda and even Togo. We had a young lady from Togo speak about how she birthed into Togo. And we're looking at her like that happened in Maimonides a couple of weeks ago. Like we're looking at her with no real reason to understand that there was any difference in the birthing aspect. And that's this is an industrialized country, so we say, and that's a non-industrialized country. So why is there such a disparity? Why is there such a thing that we're seeing in 2020 that looks so relevant to their 2020, and we're in two totally different lands? So we're making the advantageous act of going there and learning, and then having them come and learn from us so that the medical professionals can now see and then give solution. So that's our 2021. I'm going to be in West Africa with ECOWAS, and we're going to be in Ghana, Nigeria, Gambia, Guinea, and Mali. Mm-hmm. So this is where we're going to take our U.S. trek into the West African countries. And then we're going to have some from the East, South, and Central Africa coming here to the United States. So that's my 2021. And anything else is just probably going to be more education and more influence on getting us past this COVID thing.
Yeah. Well, before we go, please give our viewers an opportunity to find out how exactly can they get in touch with you and the work that you're doing. Sure.
My website is really easy. It's FIGHR. It's like fight without the T. It's FIGHR.org. And that's the website that will have all of the programs that we have, all that we do, all the areas we're in, and especially ways that you can get involved. My email address is FIGHRinfo So that's FIGHRinfo@gmail.com. And a number is 347-770-5121. That's a direct connection that also does voicemail and text. That's 347-770-5121. Dr. Amina Ali, our guest, thank you so much for coming and sharing with us. Great conversation, very much enlightened. And keep up the great work. Thank you. Thank you. I'll see you again. Bye-bye. All righty. Well, we'll have more show. We want you to stay with us. We're taking a quick break. We'll be right back right after this. Welcome back. Student Debt Crisis is a not-for-profit organization that's dedicated to fundamentally reforming student debt and higher education loan policies. Student Debt Crisis takes on a personal approach, I should say, to member needs, actually working directly with borrowers to understand their challenges and fears, repayment obstacles, as well as frustrations. Joining us now to share a little bit more about the student debt crisis and also student debt forgiveness was something that Joe Biden has talked about in his campaign. We'll talk about that in just a few seconds. We're pleased to be joined by the Program Director of Student Debt Crisis, Cody Hounanian, and we thank you, Cody, for being with us.
Thank you, Daren. I appreciate the opportunity. And as you mentioned, there's a lot to be talked about right now related to student loan forgiveness, or what we call cancellation. So this is a great time to talk about this topic.
Well, we'll get right into it. I mean, obviously, let's go front and center with what's political. We do have a new President-elect Joe Biden. He's been very outspoken talking about student debt and student debt forgiveness, talking about possibly forgiving $10,000 of debt for students, and then also for the rest who attend public colleges or historically Black colleges and university that earn about $125,000 a year. Having a new president-elect and the work that you do, are you optimistic that we can see this forgiveness happen real soon?
I'm unbelievably optimistic about the opportunity to have large amount of student debt canceled, and also excited for the opportunity to have an administration that will work with us after debt cancellation to make sure that we address all the student loan debt in America, that we make college free so we don't have another student debt crisis in the future. All of these are possibilities with the Joe Biden administration. And, you know, I have to give it the president-elect a lot of credit. When he started this campaign, his platform on student debt and higher education wasn't what it is today. His beliefs have evolved, and that's because he's listening to advocates. And more importantly, Joe Biden is listening to the millions of Americans that are crushed by student debt and now also impacted by the COVID-19 crisis as well.
Yeah. And when we talk about debt reform, obviously before COVID-19, millions of Americans have actually struggled with student debt. I remember hearing former President Obama talk about it took him until his presidency to pay off loans. If this is supposed to be something we're supposed to be doing here in America, gaining an education, the process of having to pay this off, it becomes so tumultuous in the life of a person. Talk to us about, you know, your work and what this does and how you're trying to help to give some relief to some people who are very highly impacted.
Yeah, well, you mentioned it at the beginning of this segment, Daren. We do work personally with student loan borrowers. We talk to hundreds or thousands of people impacted by this crisis every year. And there's stories that stick with me. You know, we worked with a gentleman here in Sacramento to pass legislation, and he was someone who spoke at the state legislature. And this is someone who was had a master's degree, someone who was a pastor, a faith leader, and had their life crushed by student loan debt. Their retirement was impacted. Their Social Security was being withheld. This was an older gentleman. I mean, this person's entire life was hurt by the crisis. That's why, again, we are thrilled that an administration is coming into place that cares about these stories. You know, Donald Trump and Betsy DeVos, not only were they not allies to student loan borrowers, they were attacking student loan borrowers. They were preventing them from getting access to programs that are written into the law. So we're going to have allies in the White House again. And we also have, most importantly, a lot of allies in Congress as well. So, you know, we're really excited. Even today, before we filmed, Senator Elizabeth Warren and Senate Minority Leader Chuck Schumer tweeted out their support for canceling a large amount of student loan debt, not only to help people impacted by COVID, not only to stimulate the economy, but also this other element, which is really addressing the racial disparities that exist in our higher education system, the wealth gap that is persistent out there. Student debt cancellation can help heal the country on all of these fronts.
Yeah. Talk to us about from a social justice perspective, because I do feel like when we talk about this, there is an issue of social justice attached to student loan debt. How do you view it? How do you, and how would you make an argument for that?
I'm glad that you brought that up. You know, let's start with the problem. The problem here is a student loan debt crisis, and the problem itself is distributed disproportionately amongst students of color. So we know Black women, they have more student loan debt per student than any other group. We also know, because of the persistent wealth and wage gap, that we see students of color and particularly Black students pursue graduate degrees at a higher rate. A lot of people don't know that our students of color are some of the most ambitious and successful students that exist. But when you go further down your education track, that means a lot more student loan debt. And what is also a persistent problem is these predatory for-profit colleges. These are the schools that have given people tens of thousands of dollars in student loan debt and then offer them a degree that is virtually useless when it comes to accessing a high-paying job. So all three of those issues combined are partly why we see a disproportionate student debt crisis. Now, on the other end of this is the opportunity for debt cancellation to be a powerful equalizer. And so what we see is that not only will student debt cancellation lift the debt burden off of students of color's back, meaning they can take on other healthy debts like a mortgage, pay off credit card debts, just be more financially secure. But we also know that students of color have smaller debt totals. So when we're talking to advocates and we're trying to figure out how much student debt should be canceled for per borrower, we don't need that much. Anywhere from $5,000, $10,000 to $20,000 would wipe clean the student debt burden for most of the students of color who are in distress and unable to afford their student loan debt.
Yeah, I think sometimes we do get the numbers confused because we say, hey, it's an astronomical amount of debt. But you just said $5,000, $10,000, $15,000 is a simple thing that's really needed in order to get somebody's life right back on track.
That's exactly it. And if we go as far as what Senator Schumer and Warren are proposing, which is $50,000 in debt cancellation, that wipes clean a large majority of the student loan debt for most people in general. And the impact is huge for these students of color that have lower debt totals, but are having a larger difficulty paying it off. So we're thinking big. We are ambitious at Student Debt Crisis. We want to have the most relief possible, but we also know that a little bit will go a long way when it comes to fixing and making up for what has been this immoral and unethical student debt crisis.
Yeah, you referenced earlier Senator Liz Warren, Senator Chuck Schumer going and saying in favor, tweeting out in favor. Talk to me about political help and political allies. Are you finding more and more political allies beginning to line up now in this area? I know for a lot of people, they were hard and fast no, but you talked about President-elect Joe Biden evolving. Are we seeing more other people begin to evolve?
I'm so glad you brought that up. We are so thrilled about this opportunity to achieve student debt cancellation explicitly because we are seeing more allies and partners join on. So first off, on the grassroots advocacy side, student debt crisis, we've been banging the drum for years that this is a crisis, but we're seeing organizations from civil rights groups, consumer rights groups, from student-oriented and campus organizations all take on this crisis, and now they want to make a big difference. Also, you nailed it. We have allies in Congress like we've never seen before. I have to give credit to Senator Schumer as the minority leader. He is really pushing the party to think boldly about student debt cancellation. I take it seriously. When Senator Schumer says that he wants to cancel student debt, that is a huge win for this movement, and it means a lot to have this minority leader join this cause. So I'm really excited about that.
Yeah. Share with me a little bit about COVID-19, how that's actually impacted the work that you're doing. And there's also the life of students who are really trying to deal with this whole thing about debt relief. Somebody may not know how there's relief involved, and also a little bit of a delay, if you will, in terms of if you got a problem with paying it off, how that works out for those who have dealing with COVID-19.
Yeah, the COVID pandemic has really turned this issue, this problem upside down for so many student loan borrowers. So in March, when this crisis really became a national emergency, the first thing we did was get to action to make sure people understood their options. So in the last six months or more, we've been hosting free student loan clinics online with some partners like a tech startup called Savvy, to make sure that people understand their rights and enroll in the programs that can make their payments affordable during this really difficult time. So that's another element of student debt crisis's work. It's not just advocacy. We need to educate and inform people as well. And that's one of our missions.
Yeah.
But on top of that, COVID-19 is, as we all know, is disproportionately impacting many communities that are already vulnerable. So the second part of our mission was, let's find out what's going on here. How are people being impacted? And so we did a survey of 40,000 student loan borrowers, and we found out that Black and brown students were the least likely to know that they had repayment options or that there was COVID-19 specific relief that was passed by Congress. We found that older borrowers were facing unique challenges when it came to supporting small businesses. So we're seeing this crisis, the COVID-19 health crisis, bump right up against what was already the student debt crisis, and it's impacting communities in many unique different ways, and they all need to be addressed separately.
I think you touched upon this just a second ago when you talked about knowing your rights and some of the common mistakes that people make. And they make mistakes because simply a lot of people just simply don't know their rights. What are some of the common rights that people have that maybe we don't know?
Yeah, Daren, that's a great point. You know, before the crisis even started, people already had difficulty understanding their student loan options. Now, since the COVID-19 pandemic began, we've seen rapidly changing policies at the federal level that have changed when people will make their payments. There's been a 6-month plus pause on student loan payments. A lot of borrowers were confused by that. And so in January 1st, federal student loans will be sent back to repayment unless Congress or the next administration extends this payment relief. So we are going to have millions of Americans go back to student loan repayment after months of reprieve during the pandemic. And so they need to know that they have rights. And that includes something called income-driven repayment. That's a federal program where a borrower can have their monthly payment lowered based on what their income is. And it can be as little as $0 a month if they have low income. There are other options as well. Public service loan forgiveness is a forgiveness program for people who work as social workers, teachers, nurses, firefighters. That program is critical, but 99% of people who enroll are denied because of minor paperwork or enrollment issues. So they need to know about that program. And lastly, there are other federal consumer protections. There's protections for people who are disabled, protections for veterans. All of these programs are really powerful, but borrowers need to know about them to take advantage of them.
So let's talk about this for a second. A lot of people make mistakes. The time to recover from those mistakes previously in time past has been a long period. Are we looking at possibly seeing a slower, or I should say, better options for those who may have a hard time navigating this whole repaying, the debt issue, the weight that just comes with it? Do you think that things are really looking better?
Well, you know, for borrowers that have been feeling this sense of hopelessness for years, I think this bold policy proposal of enacting debt cancellation is a light at the end of the tunnel for so many people. If you feel like your legislators or those in Washington, D.C. haven't been listening to you because you have student loan debt, this is a big, big plan that shows a serious commitment to addressing this issue. And so that alone, I think, will give people a great feeling about what is possible and what we can do to address this crisis. Now, I know that's not going to take off the burden of student debt off the backs of many people. There will still be millions of Americans that have student loan debt. What I'm optimistic about is that bold solutions like debt cancellation bring this issue to the national debate. It means that people are talking about their student loan debt. They're talking about the federal programs that exist. There's more just general awareness about people's federal student loan options when we talk about this as a big problem where there's bold solutions. And so for that reason, I think for those that will still have student loan debt after a limited amount of student debt relief, if passed, there's still hope that this discussion will be something that's talked about very seriously at the policy level.
Finally, if I'm a parent or a student, I'm watching this interview and I'm saying, listen, I want to tap into Cody and some of the stuff that he's doing. Talk to us about how the public can tap in.
Oh, Daren, I'm so glad you said it. Student Debt Crisis can connect with us. If you're interested in connecting with Student Debt Crisis, you can visit our website. It's www.studentdebtcrisis.org. And I like that you mentioned it's not just students, it's parents, it's friends and family that are impacted by the health and mental stress of student loan debt. We are all in this together as a country, and we can all be a part of addressing the student debt crisis. So join our movement, visit our website, and also follow us on Twitter as well, where we're constantly giving up the most up-to-date policy updates, because I know things are changing fast.
Things are indeed changing fast. And Cody, we want to thank you for sharing with us here on the Social Justice Forums. Thanks much.
Thank you, Daren. I really appreciate the opportunity.
All righty. Cody Hounanian, our guest here on the Social Justice Forums. And that about wraps it up for today's show. Want to thank you for joining us. And listen, if you want to catch another episode where we're going to elevate the discussion, promote civic engagement, and really get you involved in the area of social justice, tune in. BronxNet Channel 67. Verizon, that would be channel 2133. And anytime, don't forget, go back to our website, BronxNet.org, find some of those past episodes, and get yourself woke as well as active. Daren, Jaime saying take care and God bless.